Welcome. My name is Monika Jones, Program Manager with the Child Neurology Foundation. Today's talk is part of our ongoing series highlighting the stories of children and their families as they navigate their new normal living with a neurologic condition. These sessions bring together caregivers and health professionals to have a candid conversation and provide their expert advice to the child neurology community. Today, we are discussing depression and anxiety reported by parents before and after resective epilepsy surgery. I'm joined by Dr. Mary Lou Smith, professor in the Department of Psychology at the University of Toronto, and Monika Jones, executive director with the Brain Recovery Project and parent to a child who has had a large resective surgery. Welcome, and thank you for joining me today.
Thank you, Nikki. Dr. Smith, thank you so much for joining us today. Could you explain a little bit to our parents listening in what resective surgery is and introduce us to your research about depression and anxiety before and after surgery?
Certainly, Monika, I'd love to share this research with you. So if you'll just give me a moment, I'm going to share my screen. And there. There. Is that visible?
Yes.
All right. So I just prepared a little bit of a background about depression and anxiety and other psychological issues in parents of children with serious epilepsy. And I'd like to go through that just to set the stage for the study that I've done. And I will indeed come back to your question about resective epilepsy surgery, provide an explanation. Just as I get to my study. Okay. So what has the research told us about parents of children with epilepsy? Well, they sometimes have a tough road to walk on. So studies have shown that about 10% of families report that they feel stigmatized because of their child's epilepsy. Depending on the studies, about anywhere between 11 and 55% of parents have significant symptoms of depression, and for anxiety, the range is between 9 to 58%. And one study actually found that about 11% of mothers of children with epilepsy reported symptoms consistent with a subclinical post-traumatic stress disorder. Now, what's interesting is that the research has shown that mothers may be more effective than fathers in terms of these kinds of symptoms. I don't know if that's a sex difference, a gender-based difference, or whether that is because of different roles that exist in the family in terms of caregiving with respect to their children. So what do we know about the risk factors for these types of symptoms? Well, they tend to be more common in children who have emotional and behavioral difficulties or cognitive problems, or children who have significant neurological disabilities in addition to or in conjunction with their epilepsy. Depression and anxiety seem to be more common in mothers who report that they're having sleep difficulties. And I don't know whether it's because we know, for example, that depression, one of the symptoms of depression is disrupted sleep, or because if you're not sleeping well, then of course your mood is going to be affected. And some mothers also experience low levels of perceived social support, whether it be from family or a wider community network. And those with these low levels seem to have more symptoms of psychological distress. Now, it's important to think about what these symptoms are related to. Obviously, they're related to how the parent is functioning and how the parent is feeling. But we also know from research that they seem to be related to social functioning in the child. Parents with greater symptoms of psychological distress have lower quality of life, and their children have lower quality of life. Also, parental depressive and anxiety symptoms seem to be related to child depressive and anxiety symptoms. And finally, we know that mothers who have greater levels of anxiety seem to have children who have lower levels of adaptive behavior. That is, children, in terms of the children's skills in navigating everyday life. But what's important is that we also know a little bit about what can buffer these effects. And the parents who do better are those parents who have coping strategies, particularly what we call emotion-focused strategies. So this is a strategy where the parent is able to talk about their emotions, or is able to use strategies like mindfulness meditation, or even things like journaling, writing down their daily, their feelings or their, how they feel right in the moment. Also, social support is really important, and I'm going to come back to that when I talk about my own research. Also, some studies have shown that family environment is particularly important. So those families who have a lot of support and are very organized and they have consistent daily routines and interactions are those families in which the parents have lower levels of psychological distress. And parents who have wider or extended family social support networks so that they have brothers and sisters and parents and aunts and uncles who they can rely on for support also do better with respect to psychological distress. Now, just before I get to my study, I wanted to talk a little bit about this piece of research, which was done by a group in Canada. And they identified a large group of children at the time of their diagnosis of epilepsy. And they followed the children over time. And the study was to look at quality of life and how it involves and what are the predictors. But one of the things that the researchers included were questionnaires where the mothers reported on their depressive symptoms. And what you can see down here is the number of years since diagnosis. So 0 is at the time that the child had the first seizure. And then they were followed up 6 months later, 1, 2, 4, 6, 8, and 10 years later. And here we see the level of depressive symptoms as reported by the mothers. And what was interesting is that they found that there were sort of 4 different subgroups of moms. One group, shown here in green, number 1, were those who had low level or levels of depressive symptoms from the get-go, and they were stable across time. And then we see here trajectories 2 and 3, where again, we see the stability across time. 2 is more moderate levels. And then we had one group who was had very high levels of distress with respect to depression at the time of diagnosis, and they maintained those depressive symptoms over time. And finally, there was a group who were highly depressed at the time of diagnosis. But by about the 2-year mark, you can see this decline that continued down. And by 10 years after the child's diagnosis, they had low levels of depression. So somehow or other, they managed to moderate and improve their levels of depression. And what was really interesting was that what was highly predictive of depression was the role of the family environment, the support mechanisms, the ability to be able to communicate and so on. Now I'm going to come to your question, Monika, about resective surgery. As you well know, epilepsy affects about between 3 and 5 per 1,000 children. And of these, about 30% are what we call drug resistant, or sometimes you'll hear the term medically refractory. So these are the children who, despite being on optimal medical management with anti-seizure drugs, they do not contain seizure control. So after trials of 2 or more, if the children are still having seizures, these children are considered to be drug resistant. And a subset, a carefully selected subset of this drug resistant population may be candidates for epilepsy surgery. And there's several different types of epilepsy surgery. There's disconnective surgery, where actually the connections between the 2 sides of the brain are severed. And this is done in cases where seizures may start in one side of the brain and spread really quickly to the other side. And these children often fall and have significant injuries. And so the purpose of the disconnection is to prevent this rapid spread. Another type of surgery is the implantation of a device for brain stimulation, like a vagal nerve stimulation or repetitive brain stimulation. And then finally, I've listed here the resective surgery, in which the area of the brain, which is thought to be the source or the site of the onset of the seizures, is actually removed surgically. And the resective surgery can be the area of resection can be quite small, or, as you know very well, it can be a very large area of the brain, and in some children, the whole half of the brain might be removed. So the research that I'm going to talk about now, the study that we recently published, was in a group of children who were evaluated for resective surgery. And this is the study. This is a longitudinal study that my colleagues and I are doing to track quality of life in children who have epilepsy surgery, and to try to understand what are the factors that impinge on quality of life and changes in quality of life over time. And as part of this study, we included measures of depression, anxiety, and family relationships. And I'm going to tell you about the results that we have obtained from the report of 177 caregivers. 84% of these were mothers. And of their children, 63 had surgery, and 114 were evaluated to see if they were candidates for epilepsy surgery, but they did not have surgery. And that might be because they decided that they were not good candidates, or the parents said that they didn't, in the end, they just didn't want to go through with the surgery. Or in some of these cases, it hadn't, at the time of our study, it hadn't yet been decided whether or not the child would have surgery. So they were still undergoing evaluation. So all of these caregivers were assessed prior to the child's surgery and 1 year later, and it was the same interval of time for the non-surgical patients. So the first assessment was at the time of the children's evaluation, for beginning of their evaluation, to see if they would be surgical candidates. And then we followed them up a year later. And these are some of the results that we reported in this study. In the upper part of the graph here, we show the results for those children who underwent surgery in red, and those who didn't have surgery in blue. And this is the proportion of parents who reported a deterioration or no change or an improvement in the year following the initial evaluation. And what was interesting was that we didn't really see an effect related to whether or not the children had surgery or not. What was important is what's shown here in the bottom graph, is when we compared those who became seizure-free versus those who continued to have seizures. The results of seizure freedom was much higher in those who underwent surgery than it was in our comparison group, our non-surgical group, although some of those children in the comparison group were seizure-free at the time of the follow-up because of further manipulations or adjusting of their medication. And what I think is really important here is that when we compare those who were seizure-free with those who continued to have seizures, we find a significantly higher percentage of parents who showed a clinically significant improvement in their depressive symptoms over time, between the baseline, the first assessment, and the follow-up assessment. And I think another important take-home message in our study was that very strong predictors of all of our outcomes of depression, anxiety, and family satisfaction were the social, emotional, and physical support that parents felt that they were receiving within their family and within their broader family structure. So that, Monika, is our study in a nutshell, what I think are the important findings. And I'm very curious to hear from you based on your own personal experience, or perhaps comments you had from your many, many interactions with other parents of children who've undergone resective surgery, how these findings resonate with you.
They feel 100% accurate. And I can say from my personal experience first with my son, the piece that really resonated with me was this feeling of it being like a post-traumatic stress disorder. Those times when the seizures are uncontrolled. And as you know, they can come from nowhere. They're unexpected. My son was seizing almost constantly on a daily basis, but you don't know when they're happening. And the cumulative effect of that day after day is like a PTSD. And I also hear that phrase so often from other, and it's primarily mothers, you're right, that we talk on social media or, for example, at our family conferences that we put on, that you are in this terrible time, almost like being at war, where you just can't, you don't even have a moment to calm down because you're just waiting for the next cluster of seizures. And then similarly, the other message that I hear over and over again is after surgery, after successful surgery, of course, there's a fog that's lifted in a way, not just from the child, but from the family as well, because you don't have that threat of constant seizure activity. It was really challenging for us at a family. I mean, I remember personally, and I'm generally quite a happy person, I remember some very dark days and some very dark feelings that I was having because everything seemed to be so completely out of control. So I hope what happens from this webinar, especially, is for parents who are starting to consider surgery or on the fence, it's so important to know that it will also help you once you have seizure freedom for the child.
Right. I think that what's important in what you just, or one of the things that's important in what you just mentioned, and one of the things that's very important in your organization, the Brain Recovery Project, is our finding that this notion of having support can mediate these factors. And this is critical because this is something we can help families with, we can help parents and families with. It is what we call a modifiable factor. Maybe we can't change the child's brain, and maybe there's no more medications we can try, but this is something that we can help families with by directing them to support groups, so the social media, finding Facebook groups, or referring them to community resources, epilepsy agencies, or for psychological support. So I think that these things are very important. And I don't know if you've had, I know you've had much experience with them, but I wonder if you want to comment on that as well.
Well, we have a catchphrase for our conferences that we do every 2 years, and it's surround yourself with people who get it. What I hear over and over again from these parents, it's one thing to meet on social media. It's a whole other thing to spend several days with families who are on a very similar journey than yours. And we have children, with very different outcomes cognitively. My son has pretty severe intellectual impairment. And I love just watching all these parents come together, the children come together in a short amount of time, making friends, sharing stories. And over again, we do here. I felt it was like a huge hug to come to the conference and be with families who know what you're going through. I know our family tries very much to understand what we've gone through, but it's not the same. It's just not the same as being with people who exact same things have happened to them. So that makes me really happy that from a scientific standpoint, we know that helps too.
Great. Well, we hope that we're going to be able to continue to follow these children and their families over time. So it'll be interesting to see how the evolution of these symptoms and the importance of support develops with further time.
Well, thank you for everything you do for the community of children with epilepsy and who've had epilepsy surgery. We really appreciate it.
My pleasure. So shall we turn the floor back over to Nikki?
Yeah, thank you.
Thank you all so much for joining me today and sharing your expertise with the child neurology community. For more resources, check out CNF's website at childneurologyfoundation.org. Together, we are all child neurology.